Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Trish Ciccone, and we're at Central Kentucky Optometric Associates. Central Kentucky Optometric Associates has offices both in Lebanon and in Springfield. And as we're recording this, it's summertime. And there's lots of issues that come along with summer with your eyes, right? But we did have somebody recently inquire. They said that when they're in air conditioning, that their eyes tend to get really dry. Now, dry eye is actually a disease, is that correct?
Yes, it is. Dry eye is a disease, and it can be caused either by you not making enough tears or by you making not a good quality tear. The tear film is a really complicated fluid layer that covers your eye, and part of its job is to keep the ocular surface moist. The other part is to help remove metabolic waste from your corneal and from your ocular surface. So dry eye is a disease, and you can have many different symptoms from dry eye. Your eyes can burn, you can have some fluctuations in your vision, you can feel sensitive to light, they can feel scratchy or like you have sand in them, they can feel kind of sore. They can, your contact lens wear, your contacts can become uncomfortable if you have dry eye. They can become red, and they can feel tired. And probably one of the most common symptoms of dry eye, which is kind of somewhat of an oxymoron, is that your eyes can water excessively when they're dry. And so those are all symptoms of dry eye. When you are in a controlled environmental setting, like this individual who says that her eyes feel dry when she's in air conditioning, one is you can be right by the vent, so you can have excessive evaporation of your tears from your ocular surface. Or two, a lot of air conditions, they condition the air. They remove a lot of the extra humidity in the air, and hence make the air drier, and hence in those types of situations your eyes are going to feel drier.
Now, Central Kentucky Optometric Associates actually can do a test and is certified for taking care with dry eyes.
Yeah, we are a certified dry eye center and specialist center, and there's a test called Tear Lab, which measures your tear osmolarity. It's kind of like if you think of like Gatorade having metabolites in it. Well, your tears have metabolites in it too, and it actually can measure the osmolarity of your tears. And your tears should be an optimal osmolarity, and if there's an increased osmolarity of your tears, that's indicative of dry eye. We also have the test called the Inflammadry test, which measures a certain enzyme that is present in folks who have inflammatory dry eye. So it helps for us further differentiate the source of your dry eye. Dry eye is, it can be just purely related to eyelid disease. It can be related to a lot of autoimmune diseases like arthritis and lupus and fibromyalgia. Any kind of autoimmune disease can be associated with dry eye. Sjogren's syndrome, if you have dry eyes and a dry mouth, and some sort of autoimmune or connective tissue disease, then that gets grouped together as the triad of Sjogren's syndrome. There's actually a blood test that you can do now that is a biological marker for Sjogren's syndrome, so we can diagnose Sjogren's a lot easier now than we have in the past.
And what kind of treatment is there?
Well, we try and find the source of your dry eye. Dry eye can be treated just with artificial tears, but the artificial tears act more like a supplement or a crutch, because they just are trying to act as a supplement for the tears that you're either not making or that are defective that you are making. Often we'll treat eyelid disease called blepharitis, and when we improve the blepharitis, we improve the dry eye condition. We also treat dry eye with anti-inflammatory drops, especially those that have inflammatory dry eye associated with some of those diseases like rheumatoid arthritis and autoimmune disease. And we treat dry eye with a drop called Restasis. Restasis is cyclosporin emulsification, and it's an anti-inflammatory. And we treat moderate, really we can treat any of the different levels or severities of dry eye. With Restasis, depending on your particular situation, it's more effective. And in some cases, we'll actually even insert punctal plugs in to help you stop up the tears that you do make to keep your ocular surface more moist. So there's a very wide range of weapons that we have to treat dry eye, and depending on each individual situation, we'll custom design a program that's going to work for each individual.
Yeah. But the first step is to come to Central Kentucky Optometric Associates and get one of the tests to determine if that is the issue.
Yeah, you don't suffer. Dry eye is a disease. It's a real entity, and don't suffer with it. There are things that we can do, and severe dry eye or even moderate dry eye that goes on for long periods of time can cause permanent damage to the tear-producing structures in your eye, and so you really don't want to let it go. You really want to get it treated.
Great. So contact Central Kentucky Optometric Associates. They have offices in Lebanon and Springfield, and set up a test to see if you have dry eyes. Thank you very much.
You're welcome.
All right, this has been Gary White with Dr. Trish Ciccone at Central Kentucky Optometric Associates.